And I was critically ill, as ill as it gets. So, my family had to deal with me in the ICU and say goodbye and all those kinds of things. And I'm alive because doctors ignored 7 to 7 shifts and a physician's assistant who refused to accept what the insurance company was telling them because she knew what was in front of her. It would have been in a system I couldn't have navigated.
Care delivery is often dictated by the health system, if you're employed, or it's dictated by the insurance company in terms of what medications are allowed, what tests are allowed, how often do you get to be able to be seen.
Health insurance companies have hijacked healthcare, making it very difficult for doctors and nurses to do what they do best. And nobody's happy. The patients aren't happy, the doctors aren't happy, the nurses aren't happy, and the employers that pay for this aren't happy. How do you see trust in the healthcare system 20 years ago versus trust in the healthcare system in 2021?
Well, I remember when I got started, there was really this compact between physicians and their patients, and third parties played a lesser role. And now we're finding that third parties are directing traffic and actually are essentially practicing medicine without a license. And because of that, we can't make the decisions that we think are in the best interest of our patients.
We employ a multitude of people to try to help us get through this maze that we call healthcare insurance. We've found that it's become much more fragmented on a daily basis. It's become much more difficult to take care of patients, to get testing done on patients.
I still in my heart believe, we as nurses, we're caregivers, and that's being there to take care of that patient and their family, not to do the administrative paperwork. I've got to spend more time making sure I've got all the boxes checked in order to get that test, and it takes me away from bonding and making that relationship with the patient and their family that are linked to the physician that's caring for them.
I think what patients are experiencing is a feeling like they're not being heard, and that their doctors are being pressed for time. And so that trust is eroded because the patients feel like they're more of a number instead of a person.
It doesn't matter whether you're independent or whether you're employed by the health system. We all have the same problems and the same hurdles that we have to get over with the health insurance system. The number of pre-authorizations, the number of calls and other things that stand in the way between all of us trying to take care of our patients.
We know that by collaborating with the best physicians and leveraging the best technology available, we can improve the data flow to the patients, to the physicians, therefore improving the overall clinical care.
I think that physicians will be looking forward to collaboration with employers and the patients and the healthcare community. I think it's something that we've been looking forward to for quite a while. And Vxtra Health can provide that network, can provide that platform to drive care in that direction.
We know that the employer community is hungry for this type of value. Many of the Fortune 500 companies are spending millions of dollars looking for this additional value. Whether it be with patient navigation, care management, physician collaboration, we bring those pieces together and offer an end-to-end solution to the middle market employers.
Well, I am an employer, and so we have employees in our practice, and those employees need to be taken care of. If it was a system of doctors who talk together, a system of clinicians, nurses who talk together, a system with administrators who talk together, that wipe away a lot of this extra time, paperwork. As an employer, I would love that because I know that my employee will be seen faster, taken care of faster, and back to work faster, and more productive.
We believe in providing simplified solutions, meaning we provide health plans without the hassles. We base that on, number one, providing enabling technologies to physicians, patients, and employers that allows them to share more information sooner that matters. Number two, we collaborate and partner with leading physicians in their local markets in order to identify avoidable costs and ways to increase value for both the employees and the employers. And finally, we focus on the value proposition for the patients and the employers. In terms of the patients, we reduce the hassles, improve the experience, increase the trust. With the employers, we know that their number one issue is how do we deliver value at a lower cost. We ask you to join with us in helping finance this effort for the greater good of medicine and the greater good of the patient-doctor relationship. Please join us in a $5 million raise for physicians, by physicians, and with physicians.
This is an opportunity. It's an opportunity to join a movement and to do something that's right for patients, for your peers, for employers who pay for these benefits, and for the employees who are going to actually have a superior experience.
We all want to get back to doing what it was we went to school for, and that's caring for the patients.
Either you sit on the sideline or you say, I've had enough. I did not go into medicine for this. I went into medicine to take care of patients, to work together. This is a model that will work. I want to be involved. Maybe I'm not involved in the day-to-day running of Vxtra Health, but I'm involved by helping to create a Vxtra Health. You can't sit on the sidelines anymore. You've got to get involved.
Speaking as a physician leader on behalf of all my peers, it is up to us to initiate the change.
Doctors, if you really care about your patients, if you really want to get it back to them, make it focused on them, join the movement.
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 Invest today. Together, we can make a difference. Join the movement.